Park of Taylorville. Now I'm sitting down with Greg Hager, an outpatient service director for the Pana Community Hospital. How you doing, Greg?
Doing well, Tim. Glad
Awesome.
to glad to be on your show this morning.
Oh my gosh, it's so good to have you here, Greg. You're sounding great on our end. We got Greg on the phone with us today, and like I said, he's from the Pana Community Hospital. You're the outpatient service director, and let's just get started. How has everything been going over there at Pana Community Hospital?
It's been fairly busy. June was a pretty busy month, and July started off about the same. So we're keeping busy.
I'm sure the summer months tied with the holiday events, I'm sure you guys keep your hands full over there, but you guys are doing absolute best job. And you guys got a couple of things that the public could really benefit from knowing about. You got the stat stroke and the stat heart care programs going on. Can you explain to us a little bit about what those are?
Well, if a patient is having stroke-like symptoms or chest pain, cardiac problems, they come to us and we get them stabilized and probably transfer them to outlying hospital for further workup. The key to the whole thing is time is important. So if you're having those symptoms, you need to go to the hospital and get it checked out, and then be evaluated and see what's going on, so that we can um, move you along and get you to a higher level of care, so that if you need a heart cath or you need medication change, that can be done.
Yeah, absolutely. So you mentioned just knowing at the beginning to start your journey to the hospital if you need to with heart or any other conditions. What are some of the things to look out for when you know you need help or when you know to not go get help?
Well, when you get the stroke symptoms, it's maybe facial drooping, uh, slurred speech, sometimes numbness and tingling in your extremities, in your arms, legs, usually your arms. Symptoms like that with stroke. Of course, chest pain can affect people in different ways. You can have uh, stabbing chest pain, or off and on intermittent pain, or chest pain with exertion. A lot of times, especially in the summer months, everybody gets out and wants to do things when the weather's nice, mow the yard, trim the bushes, things like that, rake leaves. And so, they we're all getting older. I have to admit to that myself. And so we kind of push ourselves, and we don't want to push ourselves too far. But we're always here if in the community, if you would need us. And it's not just Pana Community Hospital; it's anywhere. I tell that for everybody that's listening in the listening area to don't mess around with it. It's something that needs to be checked out.
Totally, totally. And you mentioned maybe there are some aging members of our community, but that doesn't mean they can't get out and continue to cut their grass and all those types of things. And they still want their independence. Do you find it that sometimes patients don't come in when they need to come in, or people are coming in too often when they don't need to be coming in? Are you finding people that are just not knowing the proper time when to come in?
Well, that's a good question, because there are people who don't come in when they should. It's been going on for 2 or 3 days. Well, where were you a couple of days ago when it started?
Hmm.
But those are people, and I'm myself do that sometimes. So we just have to take it easy, hydrate yourself, especially in the summertime when the weather's warm. Just take it easy, not working as hard as you used to be able to work, and so um, take your time. We do have some people who have chronic health problems, and we encourage those to come in. They need checked out sometimes. They may have difficulty getting in to see their primary care physician, so we don't want them to wait too long. Uh, Emergency departments are for that. That's what they're partly there for, is to pick up the slack when needed.
Right, because when people's personal specialists won't always be around, and that could deter them from coming in. When in reality, uh, their problems could be solved even easier if they came in those 2 days earlier, like you said, than waiting on something. So that kind of brings us over to our next point. Well, actually, we'll kind of skip that. But you guys have a walk-in clinic over there at Pana Community Hospital. There's always people there to help out.
We do. We have a Express Care that we opened up about 2 years ago now, I believe. Express Care is open on Monday through Friday from 7 in the morning till 7 in the evening. and they're open on Saturdays, Sundays, and holidays from 8 a.m. until 2 p.m. They are connected to, they're part of the emergency department area. There's a different area. If you come into Express Care and you've cut your finger, or maybe you need feel like you need a chest X-ray for whatever reason, you'll see a healthcare professional. If you request to go to Express Care, we'll send you to Express Care. If you feel like that you don't know which way to go, the healthcare professional that's on staff right there will help you decide based upon your symptoms and those kind of things on which direction to go. But it's usually we leave it up to the patient. It's always the patient's choice, unless they're really unsure, or if when they get evaluated by the healthcare professional that it's deemed that they need to go to the emergency department. But they're right there close together. You can go one direction, you go to one area, and you go the other direction, you go to the emergency department.
That's really perfect. I feel like people don't always know. Well, you would know when you need emergency care, but I mean, the difference between express care and emergency care could be a little bit blurry sometimes. And you guys say that you guys over there will totally help with all that and point you in the right direction.
Right. We'll leave it up to the patient where they want to go. But if there's a question and the healthcare professional feels that they need to go one way or the other, they'll give them that advice. But it's always, we leave it up to the patient to determine what they would like to have as their preference.
Cool. You said you can even get a chest X-ray in the express care.
Yep. Sometimes they do those, depending upon the symptoms and things like that. Back in the COVID days, we did a lot of patient testing in that area. And so it came in handy then.
Right. Yeah. It sounds like that really was important back then. Of course, an influx and people coming in, especially then. You said a little cut on your finger, though. If you got something that needs some stitches, is that ER or is that express care?
Yeah, it just depends on the severity of the cut. They may do it in express care, and they may not.
All right. Very cool. And like you said, upon your arrival, you'll be met with someone there, and then you'll be pointed in the right direction. And you said there's two different ways to go off to, but there's one main area where you'll be taken care of.
Right. If you come to the main campus, the building at 101 East 9th Street, the hospital building, there's an area. It's marked express care and emergency department. You come in the same door, and that's where they'll greet you to determine which direction you need to go.
Sure. Yeah. One thing about those hospitals is that they're very well marked with parking lots and signs, well lit signs. You don't want to. You're not really questioning where to go over there at the hospital. So that's
very true. That's very true. You usually find that emergency sign somewhere.
Totally. Yeah. Follow the big bright red lights somewhere, and then they'll take you to the right place. How long have you been working over there as the outpatient service director, Mr. Hager?
I have been there a little over 13 years in this role.
Wow. Okay. So, you've seen quite a bit then.
Yep. Been around a while. So I have seen quite a bit.
Yeah, absolutely. And just recently, you kind of mentioned the pandemic. How did the Pana Community Hospital handle the pandemic?
Well, it was a learning experience for us as well as it was for the rest of the country. But we learned a lot from it. There was things along the road. It seemed to be a daily change there for a while till we got into the rhythm and got into what really needed to be done and what was the priorities. But I think that hardly anyone here had ever been through anything like that, as well as other places. But everyone learned along the way, and we did well. I mean, the supply chain was an issue. The influx of patients was an issue, and you learned to adjust sometimes by the hour.
Yeah, totally. I can't even imagine what the inside of the hospitals look like around here. And especially in these type of areas, we have a little bit more of an aged community. Were we impacted more that way? Were there more people coming in, maybe needing a ventilator, maybe just wanting to be prepared and safe?
I think there was both. It was those that were scared because of what was out there and had the right to be, and we didn't know the unknown at the time. And it was just everybody pitched in and did things. I mean, we had the community here making masks and all kinds of stuff you wouldn't believe. And we look back on that and think, wow, that happened. And yeah, it really did happen. And it just went by so fast that in a way it was fast and another way it was really slow. but it all worked out for the best.
Totally. Yeah. Looking back, it seems like a little blip, but during it was those times really dragged on. But you guys made it through it. Congratulations for that. And yeah, that sounds really great.
It was a very team oriented. It was a teamwork effort. It wasn't one individual. It wasn't 4 or 5 individuals. It was all of us working together. And like I said, the community did a really good job of helping us. We helped them, tried to help them. And it was just everybody working together. The staff here at the hospital were wonderful. They adjusted. There was nobody here that got laid off. There was not a soul that wasn't without work. We found something for them to do and kept them busy.
Wow. That's really great. Exactly what the doctor ordered, no pun intended there, but had everyone involved there, and that's how you guys got through it. Well, this has been really great so far, Mr. Greg Hager. He is the outpatient service director at the Pana Community Hospital. We're going to take our first short little break here for the WTIM morning show. We'll be right back.
Your information station, WTIM. Your information station, WTIM.
Welcome back into the WTIM information station. My name is Tim Zalabak, bringing you the WTIM morning show. Thank you so much to our live stream sponsors, People's Bank and Trust and Landmark of Taylorville. Now we'll get right back into it with Greg Hager. He's the outpatient service director for the Pana Community Hospital. We talked about some of the programs that they offer and how they navigated the pandemic, along with some of the walk-in services that they provide. It's all great stuff. Greg, do we still have you?
Oh, thank you. Thank you, Tim.
Absolutely. We still got you. You sound great on our end. And I just want to keep talking about Pana Community Hospital. You guys offer so many great things, and you guys have specialists over there that pretty much can cover anything on the human body here. So, what specialists here stick out to you?
Well, we do, and we have some new ones that just joined us in the last month or so. We have some 4 new cardiologists from the Springfield Clinic that have come here. We have the Prairie Heart cardiologists that have been here. 3 of those that see patients. The new ones I mentioned from Springfield Clinic. We have orthopedic. We have 6 orthopedics specialists that do anywhere from regular orthopedic surgery to joint surgery, joint replacement, knees and hips. And we have a new general surgeon that has joined along with, we had Dr. Anna Wana, who's been here for a while, and then Dr. Aaron Brewer from Springfield Clinic has joined the group as coming down here as one of the specialty clinics. We also offer podiatry. Dr. Andrew Ott comes here, and Dr. Richard Brown work in the clinic as well doing podiatry. We have other specialties such as neurology, nephrology, pulmonology, urology, and they also do cataract surgery. One of the big changes that's happened to our clinic, our Dr. Ben Esperaz, who had been coming here, and this was one of his first clinics that he ever started about 30 years ago. He retired last week, but his replacement is Dr. Yang from out of Cancer Care in Decatur, who's just stepped right in and taken over for Dr. Ben. So we made that transition, like I said, last week. So he's now seeing patients here on every week. So that's some of the things that we offer from our specialty clinic side. Have a lot of things going in our fitness and wellness and Live Well center over there that try to keep people try to keep them healthy and happy. And, sports medicine, football season will be coming on. Got Drew Kasner that does a really good job with helping the high school football sports, not only football, basketball, and everything else that Drew does. So we have a lot of things going on over here. Pretty exciting place.
Yeah, it sounds like it. You guys are fully staffed up over there with all these specialists and 4 new cardiologists, 1 new general surgeon. Oh my, all these people. And you mentioned the Springfield Clinic. You guys are kind of inheriting some of those doctors from over there. What is that about?
Well, we felt there was a need for some more cardiologists in the city, and so they came on board. They're independent of us, but they come here in our specialty clinic and see patients, and so we kind of opened that up a little bit more to meet the demand.
Totally. All right. Well, yeah, you guys are going to be totally prepared over there for everything that might walk through your doors. And you just mentioned some of the programs with sports medicine and keeping everybody happy and healthy. Can you name off a few of those?
They have all kinds of things over there. They have cardiac rehab for people who are post surgicals, or they've had a heart condition and need some extra rehab. They have a lot of physical therapy. They have a great group of people over there in the physical therapy department. I've been a patient of theirs before, and they did a wonderful job, and so I can attest to that personally. They do a great job with that. They do the exercise classes, aerobics, water aerobics, different things like that. And I also, before I get in trouble, I have to mention Quad County Home Health. We also have Quad County Home Health on our campus, so they go out and see those people who can't come to us.
All right. So Quad County Home Health also at the Pana Community Hospital. Hey, Mr. Hager, we are just about out of time here. I really appreciate you for being on with us today.
It's been a pleasure, and I enjoyed it. I hope the audience out there did. Just if you need us, we're here.
Absolutely. And that's the biggest thing there. Pana Community Hospital here to help, and they are prepared for you. That is going to be it for the WTIM morning show. Thank you so much to our live stream sponsors, People's Bank and Trust, and the Landmark of Taylorville. You've been listening to the WTIM morning show here on the WTIM information station.
Your information station, WTIM.
Absolutely. I look forward to that day. You have a great rest of your day.
You too.
Thanks.
Bye.
Bye-bye.